my name is Charmaine. I am a family nurse practitioner student at Maryville University. Today I will be doing a head-to-toe physical assessment on Miss CS here. She has been instructed already to empty her bladder. She has chose to put this on instead of a gown. And I'm looking at her general appearance, which is appropriate. Her mood is appropriate. I don't see any signs of distress. Her skin is uniform in color. And now I'm just going to check her vital signs, but I'm going to begin by doing her weight first. So I'm just going to get you to check on the scale. And I'm looking at the way she got up. Her strength is pretty good. Okay, you can hop off. 174. All right, now I'm just going to check your blood pressure here. Get this blood pressure cuff on. All right. And we're just checking her blood pressure here. Okay, so your blood pressure is 134 over 82, which is good. Respirations are 16. Now I'm just going to check your temperature here. So raise your arm up for me. Okay, axillary temperature of 97.9. Thank you. Now I am just going to begin by looking at Miss CS's head here. Her face is symmetrical on both sides. The skin looks appropriate. Now I'm just going to begin by looking at the scalp here, looking for any lesions, any type of dry skin, which I don't see. Okay, now I'm just going to palpate the scalp, and it's freely movable. I don't feel any type of nodules. Now I'm just going to move back down to her face. I'm going to begin by looking at her eyes, her external eye structures. Her eyebrows is arched, the hair is evenly distributed, the eyelashes are evenly distributed. I don't see any type of irritation with her sclera, which is nice and white and clear. Now I'm going to look at your conjunctiva, and it's nice and pink, and no signs of irritation, no nodules noted. Next, I am just going to palpate the frontal and the maxillary sinuses. Just get you to turn this way for me a little bit. That's the frontal and the maxillary sinuses. Are they tender?
No.
Okay. Next, I'm going to check your orbits. Palpate. Is it tender?
No.
Okay. And the lacrimal apparatus. Is it tender?
No.
Okay. I'm just feeling the temporal arteries. Just making sure that they're palpable. And I don't feel any type of thrills or heaves. Next, I am just going to take a look at and check your cranial nerves number 2, 3, 4, and 6, which is the optic, oculomotor, and abducens and trochlear. So first, we're gonna check to see if your pupils react to light and accommodation. All right, so you can just look over here at the wall for me. And it does react to light and accommodation. So next, I'm just going to get you to follow my finger in the 6 cardinal fields. Okay. And I'm checking your peripheral vision. Just tell me when you see my fingers.
No. 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 No.
Okay, so those cranial nerves are intact. Next, I'm just going to use my ophthalmoscope here and check for a red reflex with her eyes. You can look over here for me. Okay, so red reflex is noted in that eye. Next, I'm going to do this one. I'm saying at least 30 centimeters away. Okay, and red reflex is noted in that eye. Next, I am just going to turn on the light here. In the CS, I'm just going to get you to cover one eye. Okay, and then now the other. And I'm looking for any misalignment, any twitching, or any drooping of your eyelids. Okay, next I am just going to look at gonna move to your ears. I'm just looking at the ears to see if I see any type of nodules or any type of discharge, which I don't. I'm feeling the auricle, just to see if I feel any type of nodules, which I don't. Next, I'm just going to take my otoscope here and look inside of the ear, and I'm looking at I'm pulling it up and the auricle up and back to look. And I don't see any discharge, and the tympanic vein is intact. I don't see any type of perforations in that one. Next, I'm going to check this one, up and back again, and the same with that one. Okay, so next I'm just going to do check the hearing, which is the cranial nerve, number 8. So I'm going to check for your, I'm going to do the whisper test. So just repeat after me. Tell me whatever you hear. I'm saying at least 30 centimeters away.
1, 2, 3, 4, 5.
Okay.
10, 9, 8, 7.
Okay. So that is intact. Next, I'm going to use the tuning fork here and to do the Weber's test. Do you hear? Tell me if you hear this in both ears.
Yes.
Okay. So that's check for unilateral hearing loss, which is that was a normal finding because she can hear in both ears. Next, I'm doing the Ryan's test. Just tell me whenever you stop hearing this tuning fork.
Okay.
All right. Now, whenever you stop hearing it.
Okay.
Okay. Do the same thing on this one. Tell me when you stop hearing it.
Okay.
All right, and then this one.
Okay.
All right. So that was to check for air, to make sure that air conduction is longer than bone conduction, which it is. All right. Next, I am just going to check your trigeminal, which is cranial nerve number 5. So I'm gonna just get you to let me know whenever you feel this.
No. 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 No.
Okay, so she was able to feel this on her forehead, her cheeks, and her chin. So that cranial nerve is intact. Next, I'm just going to check your cranial nerve number 7, which is your facial nerve, just to make a series of faces for me. So raise your eyebrows, frown, close your eyes, puff out your cheeks, smile. Okay, now I'm just going to check her jaws bilaterally, just make sure that they're intact, and clench your teeth together for me. Okay, next the temporomandibular joints are intact and they're strong. And then move your tongue from side to side. Okay, and her tongue, which is checking the hypoglossal, which is cranial nerve number 12, and that one's intact also. Okay, next I'm just going to move right along to your nose. I'm looking at your nose, just inspecting for any type of discharge, which I don't see any. I'm making sure I don't see any type of nasal flaring either. And I'm just going to look inside. And the nasal septum is intact. The turbinates are intact on that one. And I'm looking at this one, and I don't see any type of discharge, and the mucus membrane looks good also. Okay, next I'm just going to check for patency. So just close your mouth and hold your nose, one nostril. Okay, and the other. Okay, and bilateral patency is noted. Next, I am just going to move down to your mouth here. I'm just looking at the outside, making sure I don't see any type of dryness noted, and that your lips is, the color is well, and that you have your, everything is uniform pretty much. So now I'm just going to get you to, I'm going to look inside your mouth. So just open up your mouth for me. I'm looking at your teeth just to make sure that your teeth, I don't see any missing teeth. I don't smell any odor. And it's nice and pink and glossy in there as far as the mucosa. Next, I am just going to get you to stick out your tongue and go from left to right, looking at the lateral sides of it. I'm just going to palpate your tongue now, just to make sure I don't feel any type of nodules. Now raise your tongue up for me. I'm looking at the soft palate just to make sure that I don't see any type of irritation or nodules noted. Next, I'm just going to use my tongue dispressor here to look at the oropharynx. I'm looking at the tonsils, and they are present, and I don't see any enlargement or any irritations noted. Her uvula is midline. Can you say ah? And the uvula is midline. Okay, and cranial nerves numbers 9 and 10 is intact, along with, which is the glossopharyngeal and the vagus, and also your cranial nerve number 12, which is the hypoglossal, is intact again with the tongue. So next, I am just moving right along. I'm going to just take a look at your neck here. I'm inspecting your neck. I'm seeing if I see any webbing, making sure the trachea is midline, and I'm just making sure that I don't see any thyromegaly or jugular vein distension, which I don't. Next, I'm just going to palpate, making sure trachea is midline. I don't feel any thyromegaly and no jugular vein distension noted. Check the carotid arteries one at a time. They are palpable they are palpable bilaterally. And I don't feel any type of thrills or heaves. And I was also palpating the thyroid just to make sure that I don't feel any thrills or heaves with the thyroid either. Next, I am just going to palpate the lymph nodes. I'm just going to check her pre-auricular and her post-auricular and occipital. Okay. Next, the tonsillar and the submental. The submandibular, all of these. I don't feel any palpable. Next, I'm going to check your your anterior and your deep cervical. And then your posterior cervical lymph nodes. I don't feel any palpable. And I'm going to feel your supraclavicular and your inferior clavicular. I don't feel any palpable lymph nodes. Next, I'm just going to check your axillary lymph nodes. Raise up your arm for me. Okay, and this one. And no palpable axillary lymph nodes present either. Next, I'm just going to listen at your carotid and your thyroid. Okay, so deep breath for me. Just hold it. And breathe out. And hold it. You can breathe out. And I don't hear any bruits present for her thyroids or the carotid artery. Next, I'm just going to listen to your temporal. Okay, and the temporal arteries doesn't have any no bruits noted either. So next, I'm just going to check your cervical spine, and I'm going to check the range of motion of your neck. So I'm just going to get you to move your neck left and right. Okay, and then shrug your shoulders. Okay, now shrug against my resistance. Okay, and turn against my resistance, and this way too. Okay, so that is intact, and her range of motion is good, and the cervical spine is also intact and good. Her strength is really well too. Next, I'm just going to look at your arms and your hands here. I'm just looking at the skin first, just making sure that it's uniform in color. I don't see any nodules, any lesions, no acne or anything like that noted. I am looking at her nails. The nails looks appropriate. I don't see any biting or clubbing of the nails. I'm checking her capillary refills, which are less than 3 seconds. Radial pulses, they're palpable bilaterally, and then you can relax. I'm checking your brachial pulses, which are palpable bilaterally. Okay, next I'm gonna just get you to raise your arm and push, and don't let me push you down. Okay, that was checking her strength, which she has very, very good strength. Next, I'm just gonna come back around here, and I'm going to check her her thoracic spine. So I'm gonna just get you to stand up for me, and I'm gonna get you to bend over. Okay, and I'm just gonna check here just to make sure that her spine is midline. She is able to bend over, so that is a normal finding. So you can come on back for me and sit down. Okay, next I am just going to cover you up back here. Okay, And I'm just going to take a look at her back here. I don't see any signs of respiratory distress. I see just regular breathing. And I'm just going to check for technical fitness. Just tell me, just say 99 for me.
99, 99, 99.
Okay, and the sounds are heard, are felt equally throughout on both hands, on both sides. Next, I'm just going to check for thoracic expansion, and I just want you just to take a deep breath for me, in and out. Okay, and one more time. Okay, so thoracic expansion is equal bilaterally. Next, I'm just going to percuss, and I'm going to make sure I hear resonance, and I'm gonna check for just to make sure that I'm checking for diaphragmatic excursion. As I'm percussing, I should hear resonance, and then I'll stop when I hit dullness and put a piece of tape. So. Okay, so I hear dullness, like right here. And I'll go back up until I hear resonance. And I hear resonance right there. And I'm going to do the same thing on this side. Okay, right here, and then I'm going to go back up till I hear resonance. And I hear resonance right here. Okay, and I'm just going to measure my tapes just to make sure it's at least 3 centimeters apart. The tape is, which it is there, and it is there. And as we can see, the right side is a little higher than the left side, just because of the fact of the liver takes up a little more room on the right side. Next, I'm just going to percuss laterally. I'm going to just get you to raise your arms up for me. Systematic manner from right to left and back and forth. Okay, thank you. And that was resonance noted on both sides. Next, I'm just going to auscultate. And just take deep breaths for me, in and out. Okay, and as you can see, I am going in a systematic manner from side to side. Next, I'm going to listen laterally. Okay, and I don't hear any adventitious breath sounds. The lung sounds are clear and it's regular. Next, I'm just going to go back to the front anteriorly, and I'm just looking, I'm making sure I don't see any type of respiratory distress up here. I'm looking at the skin, making sure that the skin looks great. I don't see any type of pulsations. Next, I'm just going to just feel, and I'm starting at the apical. Just turn a little bit for me. And I did that in a systematic manner. And I don't feel any thrills or heaves. Okay, next I'm just going to listen. And first we're going to just get you to take a deep breath for me, in and out. Okay, next I'm just going to listen to her heart sounds, and just to make sure, I'm just going to go start at the aortic first. So you can breathe regular, I'm just listening. So that's the pulmonic and the Erb's point. and the tricuspid, and now the apical. Okay, and the heart rate is regular. I don't hear any abnormal sounds like any murmurs or anything like that. My S1 and S2 is present, and the I don't hear any type of S3 or S4. So now I'm just gonna move right along to we're just gonna just palpate, make sure that you don't feel any type of crevices or anything, any nodules. Okay, so now we're just gonna move right along to the abdomen. So I'm gonna just get you to lay down for me. You can lay that way. Okay, so I'm looking at the abdomen just to make sure that I'm gonna cover you up. I'm looking at the abdomen, making sure I don't see any distension, and I don't see any pulsations. Lift up for me, make sure I don't see any hernias. Okay, which I don't see any. Next, I'm going to auscultate the vowel sounds. And I'm doing that in a systematic approach. Next, I'm going to listen to the aorta. The renal arteries, iliac, and then the femoral. Okay, so those arteries, I don't hear any murmurs and they are regular. Next, I'm just going to percuss. So just let me know if, and I should hear some tympany over the liver and the spleen, and some dullness at the bottom by the stomach and the intestines because of air. Any tenderness?
No.
And now I'm just going to palpate. Any tenderness or any pain when I'm palpating?
No.
And again, I'm doing all of this in a systematic manner. Next, I'm going to do deep palpation with the liver. Any pain? Okay. And then with the spleen. Okay. Any pain?
No.
All right. And that is it with the abdomen. Next, I am just going to go on down to her feet and her legs. I'm just feeling the skin first of all, just to make sure it's nice and warm. The temperature is good here. I don't see any edema present. And I am making sure that I'm looking at the hair. She has no hair, she shaves. I'm checking capillary refill, which is less than 3 seconds. I'm checking her pedal pulses, which is palpable, posterior, tibial, and the popliteal pulses, which are palpable. Okay, next I'm just going to check your strength, so just push your hands up against, your feet up against my hands. And her strength is definitely strong down here. Next, I am just going to get you to sit up. And her range of motion is good. I'm checking that throughout. I'm gonna do your reflexes now. Okay? So now I'm gonna start off, let's do the brachial reflex here. Okay. And I should see the forearm. Okay. Pronation of the forearm with this one. Okay, which I do. Okay, next I am going to do the popliteal here, reflex. And I'm just going to hit, and I should see some foot. Okay, all right. Next, and she has her, that patellar reflex is definitely intact. Next, I'm going to check the Achilles tendon. And okay, and she does have her Achilles tendon reflex is intact because her foot has plantar flexion. So that is it. I'm going to now discuss the findings with Ms. CS here, and I've been checking her neural system throughout the whole assessment, and her musculoskeletal system has also been getting checked throughout the assessment, and that is it. Thank you.